America's Frontline Doctors is a group of doctors who aim to dispel misinformation aimed at COVID-19. They gathered here today in Washington, D.C. in front of the Supreme Court to give that information to the American people. After the event, I had an opportunity to speak with some of them, and here's what they had to say.
Early treatment is what we need. It is effective. It will save lives, so we need early treatment. I created a telemedicine platform called myfreedoctor.com, where I'm treating patients for free in all 50 states. All they have to do is go to my website and track me down.
We just aim to bring truth and information to the American people. Early treatment works. There's a lot of early treatment options. Masks don't work. If you want information on both of those things, they're on our website.
We need to stand up and talk about Section 230. This is something these news organizations, these social media platforms specifically, cannot be allowed to act as publishers while still being protected by Section 230.
Well, I mean, the CDC just actually came out with these numbers in July, and they showed that of the people they looked at with COVID, 85% had said they'd been wearing a mask always or usually. Now, what does that tell you? Only 3.9% of that group said they never wore a mask. If masks worked, you would see some different numbers. In fact, the control group, that group, same numbers. So 85% of people are wearing a mask, and it's not necessarily doing them any good.
We've treated 1,900 positive patients with the successful use of hydroxychloroquine, zinc, and either Zithromax or doxycycline. We have had one hospitalization and a 0% mortality rate. And we noticed that treatment early, within the first 2 days to 3 days of diagnosis, had that high success rate.
I'm a child psychiatrist in West Los Angeles. All of my kids are scared. And I've been noticing that around the country, this fear has morphed or devolved into something even more eerie, which is a state of delusional psychosis, this belief that we must keep everything closed, we must hide, we must mask ourselves in order to save lives. And I'm very, very concerned that mental illness, that hysteria that's overtaken the country is moving into something even more sinister, which is social control.
People need to know that there's early treatment that can be successful, and they need to put their foot down and demand early treatment, because I don't think, after everything that's happened, I don't think it's going to come from the top down.
Right now, they're still trying to drive the narrative that we have a pandemic going on. We don't.
I think that the media has largely spread disinformation about the virus, and I think that this is a very treatable condition if treated early and aggressively. And so that's what I've been doing in my clinic with enormous success.
The greatest thing is, see your doctor. I mean, our patients were told, stay at home, don't call your doctor, don't see your doctor. I'm a pediatrician, so I'm on the front line to keep our kids safe and prevent disease and treat disease.
The biggest message that they wanted the American people to take away from today is that you don't need to fear COVID-19. Doctors are capable of treating you, and if you have any concerns that you could be sick, talk to your doctor.
Hello, everybody. I'm Dr. Simone Gold. I'm a board-certified emergency physician and the founder of America's Frontline Doctors. I'm also a Stanford University educated attorney, and we've come back with some of my group for the second White Coat Summit. We're here to speak to America just like we did on July 27th. At that time, we brought the American people truth and hope and optimism. And we're here to give you more truth and more reasons to be optimistic and to not live in fear. There continues to be a great deal of disinformation and outright censorship. Since our summit, the censorship, unfortunately, has gotten worse. Because of that, we've established a website, America's Frontline Doctors, where you can find the truth, where the truth is not censored. You can also follow most of us on social media. Today, we're going to bring you information about masks, about lockdowns, about, most importantly, early treatment, reasons to be optimistic. We're going to dispel the myths. I want to start with masks, and I start with this because there's a legal crisis, a constitutional crisis that we're not recognizing. And it is, to some extent, personified by the forced, mandated wearing of masks. Let's not tiptoe around the great big elephant in the room. The facts are actually not in dispute. Masks are completely irrelevant in blocking the SARS-CoV-2 virus. If you doubt that, you must watch the educational session that we've done about the myth of masks. I encourage everyone to do their own internet search and discover that prior to March 2020, there were no scientific journals that asserted that masks could keep out a virus. That's simply not how that works. A virus is 1/1000th the size of a hair. Consider what our Emperor Fauci said when asked if he's sure that masks work. Now remember, he is not new to the game. This has been his life's work for decades. There was no chance that what he said was a mistake, and there is no chance that SARS-CoV-2 is different than any other RNA virus that he has made his life's work. Dr. Fauci said, when you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it is not providing the perfect protection that people think it is, and often there are unintended consequences. What the New England Journal of Medicine, a premier medical journal, had to say about masks, the following: it is clear that masks serve symbolic roles. Masks are lucky charms that may help increase healthcare workers' perceived sense of safety and well-being. Thus, although such reactions may not be strictly logical, we're all subject to fear and anxiety, especially during times of crisis. Expanded masking protocols' greatest contribution may be to reduce the transmission of anxiety. That is per the New England Journal of Medicine. I will put it plainly to you, my fellow Americans, you have been lied to by the media. Propaganda is not a new phenomenon. Thomas Jefferson said, "The man who reads nothing at all is better educated than the man who reads nothing but newspapers." And John F. Kennedy pointed out that it does not matter if the propaganda had a sinister purpose. The great enemy of the truth is very often not the lie, but the myth, persistent, persuasive, and unrealistic. These days, Americans fall into three groups: those who recognize the propaganda, those who have been successfully propagandized, and those who don't care. We'll just leave them out of it for now. My message is for mask believers who have not yet realized that they are victims of propaganda and who also think it is no big deal to force other people to wear a mask. In fact, there are three enormous problems with masks. First, mask mandates are spreading fear and hostility that is changing American culture. We are less friendly, less interactive, more hostile, quicker to be angry with our fellow citizen. Masks are very socially divisive. There is mask shaming and mask virtue signaling. There's hashtag social compliance, and there's citizen policing of sidewalks and airplanes and restaurants. And in addition to hostility, masks bring a palpable sense of fear that is totally unwarranted by the facts. There are actual human beings who believe that others will be harmed if they don't wear a mask, and this is tragic. Second, mask mandates cause an insurmountable civil libertarian issue. In the American legal system, the government cannot force a facial covering because all rights not expressly given to the government belong to the people. The government has neither common law nor statutory right to mandate clothing. Encroaching on a right that belongs to the people is extremely dangerous. One of our founding fathers, fourth president, James Madison, said, "It is proper to take alarm at the first experiment on our liberties." We hold this to be the first duty of citizens and one of the noblest characteristics of the Revolution. The free men of America did not wait till usurped power had strengthened itself. Third, wearing masks is a national security issue. When most of the citizenry of our country can so easily be persuaded to do something that is so clearly against our own Constitution, our enemies certainly take notice. We are quite literally telegraphing our weakness and social divisiveness to our enemies. Now, to those Americans who are genuinely afraid, we are physicians. We are here to help you with these facts to reduce your fear. First, we'll do the facts, then the emotion, and then the call to action. The first is the facts. Notice that what the experts had said for months is wrong. There are not 2 million dead. Our healthcare system was not overwhelmed. There were 10 times the number of ventilators that we needed. Nearly everyone survives, and early treatment works. You must not ignore your own life experience. If all you had to do to stop a virus was hold a tissue paper to your face, your ancestors would have learned this centuries ago, and your grandmother would have taught you this. Second is the emotion. Consider that what President Jefferson said 200 years ago, that newspapers are propaganda, and also what President Kennedy later pointed out, which is that it does not matter if the propaganda is a myth or a lie. Kennedy said, the myth that is persistent and persuasive. Realize that just because you believe or feel something is true does not make it true. There has been a massive propaganda campaign to get you to believe something, but you have it within your power to dismiss the propaganda. A simple internet search reveals that no scientist ever believed a mask, let alone a bandana, was relevant against a virus right up until COVID-19. The myth of masks came from politicians, and when something happens in politics, you can be darn sure it's done for another purpose. Third, a call to action. To the mask believers who have been angry at people who won't wear a mask, I call on you now to double your anger, but direct your anger toward those people who have lied to you. It is the people who are angry who have the power to fix the social divisiveness. We need you to put your anger squarely where it belongs. Unleash all of your fury on the professional media complex that has lied and lied and lied to you. And the final call of action to all Americans. So-called experts keep telling you that a bandana can stop a virus that is 1,000 times smaller than a hair. How stupid do you think we are? To all Americans, we say, we will be fooled no longer. The tiny emperor has no clothes. Thank you.
Wow. Hello, America. I'm Dr. James Tadaro. I received my medical degree from Columbia University in New York, followed by 4 years of residency training. On these same steps, 3 months ago at the last White Coat Summit, I talked to you about big tech censorship, how Google was taking down scientific articles, how YouTube and Facebook were censoring evidence-based medicine. But I'm not here to talk to you about that today. I'm not here to talk about the censorship of the present. I'm here to talk to you about the deletion and rewriting of history. Unbeknownst to many, news organizations are deleting articles from the past that no longer fit the narrative today, the narrative of fear, panic, and lockdowns. Case in point, earlier this week, I tweeted out a Forbes article. The Forbes article is called "Why the World Health Organization Faked a Pandemic." It was a scathing review of the World Health Organization's over-exaggerated response to the swine flu 10 years ago. It was a 10-year-old article. I tweeted that out, okay, and based on the content from that article, COVID-19 pandemic would be considered one of the mildest pandemics of the last century. About 12 hours after I tweeted out that article, Forbes deleted it from their database. Not Twitter took it down. Forbes actually deleted their own story from 10 years ago, overnight, when I drew attention to it. And that's going on unnoticed, continually. These news organizations are deleting history. Now, this should scare you. This is directly out of George Orwell's 1984. We need to rise up against censorship of the present, but also hold news organizations accountable for their past. Thank you.
Thank you, James. Thank you, Simone. I'm Dr. Richard Urso, and I'm a board-certified ophthalmologist, and I'm part of America's Frontline Doctors. And I got involved because early on in this pandemic, I realized that we had treatment for this virus. Now, my background's in drug development, and I've repurposed drugs for use on the eye, 8 different drugs, and I actually developed a drug that's been patented and made it through the FDA. So I looked carefully at this, and I could not believe that we were going to let patients go without treatment, die, get on ECMO and ventilators. It made no sense right from the very beginning. Anybody who said that this made sense at the very beginning to lock down, it never made sense. It was clear that we had treatment. Now let me explain that. What is this? This is a virus, right? So we get infection, inflammation, blood clots, and breathing problems. Does any doctor know how to treat inflammation? Every doctor does. Does every doctor treat infections? All the time. Does every doctor treat vascular disease and thrombotic episodes? Absolutely. Can we fix breathing problems? Of course we can. Okay, so that's why this whole thing was a lie right from the very beginning. Okay, so let me just say that again. Anybody who tells you different, that's science fiction. That's not science. And anybody who tells you different, that's a physician, that's hypocrisy. We're about the Hippocratic Oath, about taking care of patients and making sure we keep them from passing away, okay? So the next thing I want to talk to you about is what's going on right now in terms of this testing and this PCR and what I will call a case-demic. So do we now still continue to have a pandemic? And what we're seeing here right now is we don't have a pandemic any longer. I've got a little chart here, and I'll try to have it available for you to look at, but let me just explain it. Do we have a pandemic? Does a pandemic last forever? Never. Our bodies are amazing things. They will fight viruses, they will fight bacteria, they will fight all these things. And what we see historically, even when we didn't have weapons that were that great, 1918, 1957, we have a small peak, a large peak early on. A lot of people are getting cases, a lot of people are dying. About 100 and 110 days later, what happens is you get a small peak, follow it up, and here you'll see the big peak in March and a small peak in July. And now we're at the end of that. The pandemic is over, okay? There's still going to be people getting sick and there's still going to be people dying, but not in massive numbers. So what do we have right now? What's the fear? What's driving the fear? What they're doing is they're taking a test called PCR, and they're driving this whole thing with fear because we have a lot of people with positive cases. You know, some people are smart enough not to believe it. The president of Tanzania actually tested a goat, a quail, and a pawpaw, and they all came back positive. And guess what? The pawpaw wasn't sick. So let me tell you, here's what we're seeing. We've got early on in March, I know it may be hard to zone in on this. We had a lot of cases and a lot of people died. Now here we are at this time of the year, September. A lot of cases. You see the red, there's very little red there. That's because they're basically driving this with fear, and they're trying to make us believe that we need to stay locked down. The Netherlands, here it is right here. Only reason I brought this one, look at all these cases, and basically nobody's dying, no one, okay? And they just locked down again. How does that make sense? We know it doesn't. So America, just know, we have treatment, we have things that work, we can treat every part of this disease. We no longer have a pandemic, we're at the end of the pandemic, and this fear and loathing is from this driven PCR testing, which is actually false positives, okay? We need to go back to living our lives and get back to the way we know we did things in the past. Thank you.
Thank you. I'm Dr. Lee Merritt. I graduated the University of Rochester, New York in 1980. I completed an orthopedic residency, a spine fellowship. I served 10 years as a military surgeon. And I was on a congressional committee that looked at technology for the Navy. I'm a spine surgeon. I've spent 40 years of my life in a mask. And I can tell you in my entire career, as Dr. Gold alluded to, nobody was talking about masks as a control mechanism for viruses. Now, I understand why they can convince people they work, because when you put on a mask and you sneeze, you can tell that it hangs on to those sneeze particles. Unfortunately, the problem that makes people sick, the problem that transmits virus, are the little particles you don't see. The large particles that you catch in a mask, they're dead virus. If you're even sick with anything, they're dead virus. It's the small, invisible 0.12 micron viruses that sneak out through the mask, around the mask. They're like golf balls going through a tennis net. Okay, our masks, even the very best medical mask, cannot screen out, cannot protect you from this kind of small particle virus. And the other falsehood is they would like you to think that you spread this to people because you cough on them. No, nobody coughs on each other. When's the last time you ever coughed on anybody? What really is happening is if somebody's diseased and they have this virus, it gets into the atmosphere, and the whole fluid, the air fluidity is filled with little viruses. We have it around us all the time. You can't mask that away. Now, that doesn't mean there aren't options. There are treatments, as we just heard. There is also environmental mitigation. Turns out humidity is great for this. But masks don't control viruses. They control you. And the biggest myth in this is that they're not damaging. You hear people say all the time, well, they may not do much, but they're not really hurting anybody. Yes, they are. Besides what they're doing to society as a whole, separating us, isolating us, think about what they're doing to our children. You know, children need to look at faces to learn how to be a human. Reading faces is part of humanity. Interacting with people. We are creating a generation of children that have an inchoate fear of things. A 4-year-old doesn't understand what's going on. And we are making a generation of children that are afraid of their environment. That's not a way to make a healthy generation. And this is a problem that's going to waft into the next generation. We have to stop this now. We have to take our country back. You know, this is the most, I think the masks may look like they're not much. They look like they're just a little soft piece of cloth over your face. What's the big deal? The big deal is that they may be soft and they may look okay, but this is George Orwell's boot on the human face forever if we don't get this off. Thank you.
Hello, my name is Dr. Jeff Mitchell. I practiced bedside clinical medicine for 39 years before the COVID virus. I was invited to speak here in July because I was planning a trip to Africa, and I began to study, and I noticed that the death rates in India and Africa were far lower than the United States. And this persisted from May through July to the present day. It turns out that a person is 35 times more likely to die of coronavirus in the United States than in malaria endemic sub-Saharan Africa. So that's the reason I was invited to speak here, because the government's not looking at this data, and we asked them to look at it and help bring the protection that those people have to the United States. I'm also a lawyer, and I noticed along the way something very unusual about the whole way this pandemic was treated. And we call it upside down medicine. You've all seen it. You've seen it from the beginning. You were told, don't go to the hospital, don't go to your doctor, stay home, take some Tylenol. Maybe if you get really sick, you can come to the hospital. And this whole idea of you don't need a diagnosis, you don't need treatment, is simply backwards. It's simply upside down from the way medicine's ever been practiced from the beginning. And in fact, this failure to diagnose, this failure to treat, is what used to be called medical negligence. It's completely backwards and upside down. And we need to recapture medicine. We need to let doctors be doctors. We need to let doctors have a relationship with patients and treat patients, and not have medicine controlled by bureaucrats, by pharmacy boards, by attorneys general, by federal prosecutors. We need to put medicine back into the hands of doctors, because we have treatments, and there is reason for hope and optimism because we have treatments for coronavirus. Thank you.
Good morning. My name is Dr. Jeff Barkey. I'm a board-certified primary care physician. I've been in private practice for over 25 years. I'm also a former 12-year elected school board member and the co-founder and current chair of a new free public charter school in Orange County, California, called Orange County Classical Academy. I'm here this morning to talk to you about children and our schools. We must stop the unnecessary fear that us adults have imposed on our children. The CDC's own data and the science shows that every school in America should be open. The data is clear. From the CDC's own website, if you're less than 20 years old, the survivability of COVID-19 is 99.997%. Well, what does that mean? If you look at the death certificate, the death numbers in the United States, less than 15 years old, there's been 72 deaths of children in the United States. Now, every death is a tragedy, but let's put this in perspective. Every year, there's over 600 traffic deaths in children. Every year, over 350 children drown. Influenza every year, and this past 2019-20 season has taken the lives of 125 children. Cancer kills more than 1,800 children every year. So what I'm here to tell you is a child has a greater risk of dying in a car crash going to school than they do of dying from COVID-19. Most importantly, the notion that somehow our children spread this virus to at-risk adults just isn't true. There's been several studies that have come out recently, including in the Atlantic, where they looked at 200,000 kids in 47 states. The conclusion is kids rarely get ill and they don't spread this virus to at-risk adults. There's a German study of over 2,000 students in 13 schools. And what that showed, and the authors concluded, that in fact children act as a brake upon the virus spreading to adults. And then recently a Yale study came out, 50 states, 50,000 child care centers. These children did not have masks on, and there was no evidence that these kids were getting sick or spreading this virus to adults. So the bottom line is this: schools in the United States must be open. The fear of this virus is causing more harm than the virus itself, with increased anxiety, increased suicide, increased depression. We must open the schools, and we must stop spreading unnecessary fear to our children. Thank you.
Hello, my name is Dr. Brian Tyson. I'm a board-certified family medicine doctor. I have over 14 years of ER experience and hospital medicine experience. We opened up our own urgent care about 2.5 years ago in the rural community of the Imperial Valley, El Centro. We were at the heart of the pandemic with one of the highest risk populations in the nation due to our large Hispanic and diabetic population. We border the city of Mexicali, which has 1.5 million residents. We took on the coronavirus head on. We saw over 20,000 patients in person. We treated this virus early. We treated this virus aggressively. And we only had 1 hospitalization and 0 deaths. 0 deaths. Because we were not going to stand by and allow people to die without treatment. We were told to stop testing. We were told to stop prescribing, but we didn't. And we continue to treat today, and we've treated over 1,900 positive patients. We've treated patients from 11 months old to 90 years old. We treated patients with pulse oximetry less than 90, with chest x-rays that were filled with inflammation and fluid. We sent them home with treatment. We reevaluated that treatment, and every one of them has survived. I'm here to tell you, at the beginning of this, we were all afraid. But my staff and myself, after going through this and seeing this eye to eye, we are no longer afraid. We can go back to school again. We can go back to work again. We can go back to life again. And we can go back to being Americans again. We do not need to let fear take our freedom.
Good morning. My name is Dr. Robin Armstrong. I'm a board-certified internal medicine physician who owns my own practice in Texas. I take care of hospitalized patients, and I also take care of nursing home patients. And in my hospital patients, I've treated patients with remdesivir, with Actemra, with IV dexamethasone, with convalescent plasma. And we've seen a lot of patients die, and we've seen some of those patients get better. But in my nursing home practice, we have the opportunity to treat and successfully treat our nursing home residents with a safe, inexpensive treatment. We used hydroxychloroquine, azithromycin, and zinc, and those patients got better. These were the frail patients, very sick, elderly patients who got better from this treatment regimen. Now, the media and a lot of fake doctors on television will tell you that hydroxychloroquine is not safe. And I'm here to tell you that is an absolute lie. The media has lied and people have died. The President of the United States got early treatment with another therapeutic that Operation Warp Speed made possible. Early treatment is the key, and there is an inexpensive alternative. We are here today to say that COVID-19 does not have to kill, COVID-19 has therapeutics that you can be treated with if you're treated early, and that you do not need to walk in fear any longer. Thank you.
I'm Dr. Mark McDonald. I'm a child and adolescent psychiatrist practicing in West Los Angeles. I've seen hundreds and hundreds of children since early 2020. They are all afraid. Years ago, one of our presidents said, "We have nothing to fear but fear itself." How did we get from that to we must be afraid? Fear is good. Fear is mandated, and worst of all, fear is virtuous. Well, one step in that direction occurred in the last few months when I began noticing a very odd and unsettling phenomenon. Not only have Americans become afraid, they become infected by a pandemic of hysteria. I'm not talking about the virus, I'm talking about delusional psychosis. A delusion is a fixed false belief, contrary to reality. Americans today believe that we must keep our businesses closed, that we must keep our children at home, that we must wear masks over our faces and isolate ourselves from human beings in order to keep us alive. That is false. That is a lie. And it is killing us. It is killing us physically, mentally, socially, psychologically. It is killing our country, and it must stop. What do we do about this? How do we change this? When people in elevators are asking you to leave, when flight attendants are telling you to get off the airplane because you've been drinking water for 3 or 4 minutes without your mask on, when Uber is telling us we have to take a photograph of ourselves with a mask on in order to get into a vehicle, we're losing our country. The way out of this, I believe, is to reject the masks, to reject the social distancing, the isolation, the lies. Most importantly, it's to reject fear as virtuous. Fear has never been virtuous, it has never been good, it has never helped anyone. Truth and courage are our allies in this battle, not fear. So let's reject fear. Let's embrace early treatment, exercise, sunlight, vitamin D, zinc, proven effective, irrefutably by science. Not by propaganda, not by politics, not by corruption. And let's take into account that thoughts and feelings moving in the right direction is not simply enough. We have to also act. We have to act in face of and in spite of our fear and do what's right. And then we can get out of this and we can move ahead and we can retake our country. We can retake our civil liberties. We can retake our health. Thank you.
Thank you. I stand proudly here as a physician, and I'm going to make a direct plea to my fellow physicians. This is a personal plea from doctor to doctor. It is irrelevant what the talking heads in the media say. They did not go to medical school. They did not complete a residency. They do not see patients. They see money signs, and they see their own self-importance. My fellow doctors, our country is in a crisis, and there are forces at work using doctors as tools in their war games. As a board-certified emergency physician working clinically on the front lines until I was fired for speaking out, I was no different than you. The media would like to say I was different, but you know I am you. The powers that control medicine have set the rules, and most of the time, we doctors comply. It is not possible to resist the overwhelming force of government. And yet, alone amongst human beings, we took an oath to help other human beings. We are truly the noblest of professions. I ask you now to look deep inside yourself and remember how proud you feel when you help someone. I say to you now, my doctor peers, that the evidence that early treatment works is overwhelming. You are a physician. You must look at the science yourself. You are not allowed, by an oath that you took yourself, to follow the orders of another person saying it does not work. Not the CDC, not the NIH, not the FDA, not Dr. Fauci, not Dr. Birx, not Dr. Redfield. There are nearly 1 million physicians in this country. Each one of us has a moral and ethical obligation to honor an oath that we made to ourselves. The science is in and the results are irrefutable. Early treatment works, and you cannot call yourself a physician if you do not follow the evidence yourself. I will not speculate here as to why the censorship of this exists, but because it does, you need to know on our website, America's Frontline Doctors, early treatment, scientific corruption, inaccuracies with testing, mask myths, practicing medicine upside down, kids in schools, the frail elderly, and most important, how to overcome the fear, can all be found on our website. On videos that many physicians did as a gift to the American people, volunteering their own time and energy. There is no reason to be living in fear. Everyone watching this video knows many people who do very well with early treatment, including our president. Even patients over 70 have a 95% success rate with the virus, but the truth is it could be virtually 100% with early treatment. Even more importantly, when doctors start telling the public the good news about early treatment, the public will believe us, doctors. Patients know we only want to help. We are not the government. Now, doctors, it is difficult for anyone to admit when you've been on the wrong path. I know of no easy way to soothe your ego. It's not easy for anyone, and it's twice as hard for a doctor. Still, you must. The fate of the nation rests in the hands of the 1 million of us who have the intellect and knowledge to say enough with the lies. Long ago, you took an oath that has existed for centuries. Your oath is to your patients and to your own conscience. You must follow that. You cannot simply follow orders. It is disgraceful that information about early treatment is censored. But as a physician, you can read the journals yourself. You can watch the videos here. You are not censored. In her hour of need, America calls upon you to serve her. This is not about politics. This is about groupthink. The way you can serve America is to read, to watch, to learn, to reject groupthink. We doctors well know the old adage, see one, do one, teach one. Your fellow physicians, America's Frontline Doctors, have brought you the evidence to see. Today you must see. You must read, watch, learn. Tomorrow you must do. Treat a patient correctly, honorably. And the next day you must teach. Teach another doctor or a patient what you know. See one, do one, teach one. We know it well. In this way, we will heal our nation. To all Americans, when you are sick, who do you call? Do you call the CDC, the NIH, the FDA? No, you call your doctor. Don't believe a bureaucratic agency that is censoring your doctor. Go to our website, become informed. Then go to your doctor knowing that early treatment works, masks do not, and if your doctor responds with fear, you need a new doctor. One who honors the Hippocratic Oath, an American Frontline Doctor. Colleagues and friends, if you are a true physician, a healer, you will stand up and do your duty. You will honor your oath. You will not just follow orders. Early treatment works. Treat your patients. When you treat your patients, you will heal America. We are America's Frontline Doctors. We say it proudly on the front of our jackets. If my colleagues will turn around, you will see we have you coming, turn back, and going. We've got you covered from front to back. We're here for you. God bless America.